Hi guys, doing another reflection for you. I know it's been a while, so I'm going to sum up a bunch of stuff today. So for my first rotation for this winter semester, I went to a Siemens Artiste unit. So it was something a little bit different to study and get under my belt. So the first thing was definitely getting used to the machine and all the monitors and the different ways the machine itself operated. So for me, completing that quality assurance on my rotational objective was the first step to really getting used to using the machine and being able to manipulate it to doing what was necessary for treatment. So after getting used to the machine and being able to make those steps, that was really getting used to the patients, to the radiation therapist I was working with as well. So I mean, I had to integrate myself into that team and really not shy away from things. So for me, the hardest part is definitely always trying to get integrated and be involved with the both patients and therapists, because I tend to be quite shy. So for me, it's really showing my abilities and my skills. So it was really trying to demonstrate confidence in my rotation. So with that being said, I mean, it's just trying to communicate with staff as well as patients. So the biggest thing that I really took away from that is my patient education. For sure, it's always been a struggle for me. So for me, definitely being able to integrate that into my practice at a greater level was a big focus of mine. The other thing was trying to become more comfortable with certain setups. Ones that I was really trying to focus on were my breast setups, and a lot of my palliative setups as well. So on this particular unit, there was a lot of palliative patients, which was great. So being able to assess them and provide them the appropriate answers to their questions, and really being able to do teachings for them and help them in the best way possible. So even just being able to assess pain levels and be able to address a patient's day-to-day needs was something quite effective in that rotation. Another thing that was probably a good opportunity for me is at my particular rotational placement, there's not a lot of head and neck cases that we tend to take care of. So we had a particular patient that had laryngeal cancer, which was something that we don't normally see. So being able to be a part of that was an amazing experience. I will be doing a rotation to a head and neck hospital, which is great. But being able to see it sort of firsthand instead of just in textbooks was very good for me, because I'm such a visual and hands-on learner. So being able to try and set that up and see that consistently, and basically it was an angled down technique, the larynx. So placing masks and the couch kicks involved as well, or couch rotations. So just having to be able to witness a different way of treating it which was good. So I mean, those were definitely some good things for me. The other things that I sort of tried to get involved with was my efficiency, my ability to basically think 2-3 steps ahead, and being able to be effective for my team, for my staff, for my patients as well. And that was something that I really did take away from that, is just trying to become a radiation therapist and keep that in mind, and working as a partner and not as a student is something that I'm still really trying to integrate into my practice, and something that I'm not necessarily doing great with. But it's because I'm a very shy person, but I need to start to feel more confident with myself and more confident with my skills and abilities. So I need to start putting that into my practice and really demonstrating what I can do. So in some situations it was the ability to have those clinical decisions and reasonings with my staff, and really being able to demonstrate my knowledge and understanding of particular setups or treatments or options that we have available to us. And I mean, really questioning some things if they're not clear or I'm unsure about some certain situations. So I mean, it's still a learning experience. Every day I learn something new, which is great. So for me, it's just really pushing to question more, and talk with my therapist about my thought process and being able to demonstrate where I want to be and what I want to get to next. And overall, I feel like this rotation went well. I experienced a lot of different things, especially with like problem solving with staff. I mean, being able to handle a situation that is controversial and see reasoning and be able to communicate effectively within a team to get to a good end, to have a positive finish for the patient. It's always about the patient. It's never about anything. It's for them. It's their safety, what we can do to make their day what it needs to be. And realistically, I found there were quite a few situations where I got to witness that, and it was good. It was constructive. It was good for me to see all these possibilities, these changes within staff and how they work together, and knowing that going to a new team and working with new people is always a little bit of a struggle, but you have to demonstrate your abilities and really maintain your practice, and try and not to fault yourself because of the way things are going, or if one particular therapist is more pronounced than you, but making sure that you are a partner, you are a part of everything, that you need to have the same sort of mindset as them and understand what they are doing makes sense to you. And don't be afraid to question others if anything is unclear or if anything doesn't make sense. So for me, having seen that between therapists was good for me to take away, and I plan on using some of their strategies in my practice and really hope that everything works out for me. So on the whole, loved my rotation on the new machine, and hopefully looking to learn a whole bunch more, which is great.